Week 3 explores public health and Indigenous-led approaches to the COVID-19 pandemic with Professor Magdalena Ugarte.
We're very lucky to have Dr. Magdalena Ugarte with us today, so I will read her bio. Magdalena Ugarte is an assistant professor in the School of Urban and Regional Planning at Toronto Metropolitan University, where she teaches courses in social planning, planning theory, and public policy. Her work examines the relationship between planning, settler colonialism, and other forms of institutionalized dispossession, as well as how communities historically excluded from planning plan for themselves. Currently, she is working with Mapuche partners in Chile on a participatory action research project that explores questions of Indigenous land use, planning, and Indigenous law. She is also collaborating with the Black Planning Project on a 3-year project that seeks to document and learn from the experiences of Black communities with planning in Halifax, Toronto, and Montreal. So we're very lucky to have her here today. We actually have 2 TMU students in the class, Mishika and Susan. So we have a lot of TMU representation. And today's session is about Indigenous-led approaches to COVID-19 and thinking about self-determination in a community with regard to public health crises. So I'm super excited for you to hear Dr. Ugarte speak, and I've seen some of the work she's going to share with you today, and it's really inspiring. And one of the things that we were trying to do for this session too is invite speakers from Council Fire to come and present. Are you all familiar with Council Fire? It's the organization just up the road. The Purple Building. So we've been in conversation with them for some time, but as you can imagine, they're incredibly busy. So they weren't able to join us for this session, but they are actually going to come to our workshop session.
Thank you to Professor Beta for the invitation. And thank you all for your interest. I think I'm going to be switching between standing and sitting because I'm getting heavier. So I need some, and also to set up my presentation here. So as Professor Meta was saying, I'm currently working at TMU here, a few blocks away in the planning school, the urban planning school. I'm from Chile originally. I came to Canada 15 years ago, not necessarily thinking that I was going to stay so long, but life happens and I ended up staying longer and longer, and I'm here. Very happy to be here with you all. And so when they invited me to talk to you today, it was mostly around this notion of public health and Indigenous-led responses or approaches in the context of the pandemic. But also more broadly, I think I'm going to be focusing more specifically in a project that I will be showing that, as Aditi mentioned. Is it okay if I call you Aditi?
Yes, of course.
It's around Indigenous or with Indigenous communities in Chile, which is my home country. But then more broadly, I think we can talk and open up some conversation about the different impacts that the pandemic has had on different communities and what that shows. And then also about different community responses, ways in which different communities responded to the pandemic, some of the initiatives that have come out of this. And I think in a space around community leadership, I think these community-led responses raise lots of questions and food for thought in terms of what communities might need to respond to health crisis like the pandemic, but more broadly, like whenever there's a need for emergency response or for anything that a community might see as a priority, right? So what I thought I would try to cover today, and we don't need to use the entire time, and I think conversation would be really great. It's again kind of like showing or setting the context for how the COVID pandemic had very different impacts on different communities in Canada, but also elsewhere, as we will see in the case of Chile. And those impacts, what they're related to, or why these different impacts, why this, we see so stark contrast sometimes in terms of how certain communities were affected versus others. which is connected, as you probably know, but we're going to explore more, to structural issues, things around poverty or lack of access to resources or to services, historical racism, etc., geographic segregation. Then second, talking about how communities have responded to the pandemic. And finally, to talk about specifically about Indigenous-led responses here in Canada, especially in Chile, my home country. And I will do this last part through this project that I mentioned, which I will introduce in a bit. Okay, so let's move right away to kind of how, when we first started the pandemic, I think we were all kind of like not knowing exactly what was going on. I don't know, as an immigrant myself, for instance, I was here, I knew suddenly I couldn't travel, no clue when I was going to be able to travel. My father, he's growing older, he's 84 years old, and this kind of uncertainty around what if something happens, what if something happens to me here, if something happens there. So I think we were all kind of experiencing that uncertainty at the beginning in different ways. And a lot of what was happening, at least in the way the media and governments and officials started talking about the pandemic, is this notion of we're all in this together. We might have seen, I mean, this is not in Canada, this is in the US, in Colorado, but I think that that messaging around, well, we are all here on the same boat, the pandemic is affecting us all equally, it's a virus and we're all susceptible to it, etc., was a pretty dominant way in which the media particularly was talking about the pandemic. And we saw how that message also kind of went deeper, permeated the way, I don't know, people or campaigns, or we were in this together. That was kind of the message of it. And I think many people from early on, but I think the more the pandemic started to unfold, the more clarity we gained. Many people started to be a bit skeptical about this messaging. It's like, are we all in this together, really? And particularly thinking about, are all communities being affected equally? And I think at some point, some people started a bit more openly, being a bit more critical and saying, well, we might be all floating in the same ocean, but we're clearly not in the same boat necessarily. Even though we saw high-level political figures here in Canada, still kind of with that messaging, we're all in this together, how do we fight that? So I think maybe what I chose a few kind of images from some studies and some media outlets to show in a way things that we already know very well by now, which is that actually the pandemic had very diverse effects on different communities, related again to numerous issues that I think we can discuss together in more depth. But for instance, here in Toronto, there were some people at Western University, some sociology researchers who were doing a study to look at vaccination rates. So once finally, for instance, the vaccine started to come up, we were dealing with two things. On the one hand, there was this idea of, well, there are areas of the city, and this applies to all cities, not only Toronto, that were considered high risk or that had higher prevalence. So we saw more people as a proportion of the total population being affected by COVID in certain places compared to others. If you looked at a map, I don't have a map here, but you could see there's more presence of COVID per number of inhabitants or residents in certain areas of the city than others. And those patterns were not casual. They coincided with other kinds of patterns that we might have seen. But then when the vaccines came, there was this kind of second layer of saying how the pandemic is affecting us all. It's not only the virus and how the virus is attacking or impacting more certain communities, but then also how politicians and how the government started to see, well, who do we prioritize? So what this map here is, what this graphic here is showing, so we see the number of adults that had at least one COVID vaccine dose, and this is in 2021. Yeah, I think this was in 2021, when the vaccine started to roll out. And we see how at the beginning, I mean, it doesn't look like a really big difference, but it was big enough to make a difference. we see how neighborhoods that had low numbers of people with COVID, so lower rates of people being infected, ill with COVID, versus moderate versus high levels of COVID, we started to see how the vaccine rollout was unfolding. So at the beginning, we saw that paradoxically, neighborhoods that had lower rates of COVID, less people with COVID, had higher vaccination rates than neighborhoods that had lots of COVID, okay? Over time, that started to reduce it. So by the end, so from April to June, we see that the government was like, well, actually, we need to be doing more, because how is it possible that places that where not many people have been infected by COVID have higher vaccination rates? Maybe we're giving more vaccines to those pharmacies, or who knows, but there was an inequity there. So they started closing that gap, and in fact, it's good to see that whatever the government was doing in that regard made sure that the places that had more people with COVID were also receiving more vaccines, because for whatever reason, certain neighborhoods had higher rates, okay? So that's one part of the story. It's how the government was distributing vaccines and who was receiving those vaccines more than others. So in that sense, thumbs up, they kind of reacted, right? But this here shows that despite the fact that there were way more vaccines being provided to the neighborhoods that needed more vaccines because more people were infected with COVID, there were the number of people getting infected. So these here are the number of cases per 100,000 residents that had COVID. Despite there being more vaccines in those neighborhoods that are in red that had high levels, they kept actually getting more and more infections. So how can we explain the fact that we're giving way more vaccines to the neighborhoods that had more cases of COVID, and despite that fact, we see that that certain neighborhoods that already didn't have lots of COVID to begin with, they keep kind of getting lower or flattening the curve, and those other people keep getting way more infected. Any ideas on how can we explain that certain neighborhoods, despite there being way more vaccines, still keep getting more infected? Not surprisingly, the communities that were most highly impacted by COVID in terms of people getting COVID, getting sick, and dying of COVID were lower income communities, generally speaking. Many times immigrant or racialized communities. And when you look, I'm sorry that I didn't include that map. There is this, actually a man at the University of Toronto, David Hulchansky, who has done a really interesting research in the past around looking at maps of the city and showing where highest and lowest incomes concentrate. And he's shown something very interesting in terms of how, in a way, money or wealthy people have moved around the city. So when we look back at the 70s, for instance, there was a really big middle class in what's now Toronto. Middle class in terms of income, right? So people, a big middle class. And then there were certain people who made lots of money, and generally they were kind of a bit dispersed, a bit in the center, but kind of like dispersed. And then there were people who were lower income, and there was a pattern. There was a bit more in what's now the suburbs, but it was a bit more evenly distributed. And particularly, there was a really large middle class, and in terms of income. And then when you look, if you fast forward 30, 40 years to now, and you look at the map, there's lots of money at the center of the city. There's pretty much no middle class. So there are many people who made lots of money, and they generally live in the center and in certain specific parts of neighboring communities. There's almost no middle class. And then in terms of lower income people, there's way more lower income people, and they are generally in the suburbs of Toronto. So when you look at the map, you have the lake here, then you have kind of the arch, and then you have the center, lots of wealthy people, and then the outskirts, lower income people. And when you look at that map, which is a map of income, and you compare it with other maps that the city or other people have produced, you see so much overlap. Because the same pattern that you see with income, when you overlap that map, actually I do have those maps, but I have them in a PowerPoint for a class. Maybe I can pull them later. And you look at where immigrants communities, new immigrant communities live, they totally match. So you see that most of the center of the city of Toronto, the downtown, non-immigrant people, particularly white people, and long-term kind of immigrants too, but maybe they came here, 200 years ago. Yeah. And then when you look at racialized communities, same pattern, you see very little compared to the, so to answer your question, a bit of a long-winded answer, but the question is, the communities hardest hit by COVID, geographically speaking, coincide with those, which connects the points that you were making. So, and it leads me actually to my next slide. So this is from a little text written by a couple of planners. They're called Amina Yassin and Daniela Ferguson. Amina, I know she's in Vancouver. Daniela, I'm not fully sure. So they wrote kind of a short opinion that was called Pandemic Patios and Flat White Urbanism, where they talk about these different reactions to the pandemic and how the name of the article, which is Pandemic Patios and Flat White Urbanism, started with this idea that at the same time that government officials were removing from the streets, for instance, encampments from the parks, they were not letting people sleep on the streets or whatever. They were at the same time closing shelters, which pushed people who live on shelters to the streets. They were suddenly making space for fancy restaurants having like these domes, or removing bike lanes to create again space for people to have a coffee on a patio. So she was saying, well, this is not about public space not being available, but it's who is allowed to be in public space when we talk about the pandemic. And it looks like people who want to go to a restaurant and who want to have like a fancy hamburger, they are allowed, and actually the city provides infrastructure and seating and things for them to have a nice patio, whatever, on Dundas Street or whatever. And then at the same time, they are not letting other people use that same space for sleeping, for instance. But I'm going to read this in case people cannot read at the back. It says, the pandemic has starkly revealed existing inequalities in our society. Essential workers who are more likely to be female, racialized, and living with underlying health conditions travel on crowded public transportation to unsafe working conditions to keep the economy running, while others can work from home or escape to vacation homes, which you were mentioning. So I think, again, all of it to point this transition in a way from the we're all in this together kind of messaging and action to this more critical take on, well, are we all in this together? Yes, of course there's a virus there, but clearly there's so many structural factors that affect who got more ill than others, who got access to public space compared to others, initially who had access to vaccines compared to others, etc. And those things, some of you have mentioned, I mean, clearly there is an issue of income and class. So people living with lower incomes many times are, for instance, women. Women are super hyper represented when we look at poverty rates. Racialized and immigrant communities are generally speaking way more overrepresented too. And then again, if we look at those maps that I'm going to try to pull after, we see that those patterns are not a coincidence. They are a reflection of racism, as you were saying, like long-term racism, which has defined where certain communities are allowed to live or not. It has, of course, to do with income and with the way, in a way, our society is structured. Point in the end that I was trying to make, or that this little conversation focuses on, has more to do with how communities have responded okay? Again, kind of leaving aside a bit the where this came to be, it's like the pandemic has provided us with an opportunity to see how communities can respond, right?
That's wonderful.
And then there are, I put, I think on the reading list, in case you were interested in taking a look later on, links to some news articles or things that speak about different things that I've been talking about. I think the study about the vaccination rates and how it changed, that's there. Then there's this other one about Doug Ford making the cheesecake and saying we're all in this together, but it's kind of like talking about a more critical stance. And then one of them had also to do with Canada's co-ops. So you know cooperatives, there are of many sorts. There's housing cooperatives, there's supermarkets that are cooperatives, there's banks that are cooperatives. So basically it's a model that has existed for the longest of times. It's not a Canadian invention. But it's this notion of when people come together and work in a format that's usually not for profit, but with a vision and a shared common goal. And for instance, during the pandemic, many Canadian co-ops on different fronts, again, from supermarkets to housing co-ops to came together precisely because they were operating outside a bit of the market to provide response in different ways, through food provision, in terms of health care. So just looking, I mean, this is a little short news article that talks about co-ops. That's a bit of a really formal, institutionalized way in which community-based organizations responded to the pandemic, depending on their subject areas. But then in addition to these more formalized, if you wish, community responses, we started seeing a number of other smaller scale responses from different communities who self-organize around different things. And again, the focus of what I was supposed to be talking more about today was around Indigenous peoples. So this, I know this is in Spanish because that's my mother tongue, and then whatever I found this. This was relatively early. Unfortunately, I don't think I have the date. But it was a news article too on Science and Ecology that read the coronavirus affects Indigenous peoples and it's actually threatening with making them disappear. It's a bit of a dramatic kind of headline. And it says in at least 163 Indigenous peoples, coronavirus has been detected with more than 27,000 cases confirmed and more than 1,000 people death. Communities are at high risk. In this case, they were talking more about the Amazon, where there are many Indigenous communities that are actually quite isolated, voluntarily too, because that's their traditional territories, and they've been quite successful at not necessarily keeping in too much contact with bigger cities. But then interestingly, and I'm getting closer, I promise, to what I'm going to be talking about. This little article also talked about early actions that Indigenous communities, in this case in Mesoamerica, so Mexico, Guatemala, El Salvador, Nicaragua, etc., were taking in the face of COVID, the pandemic. So Indigenous peoples perhaps were in a particular position regarding COVID and everything, because everything that happened in the context of the pandemic was kind of added on top of the usually very tense relations between Indigenous peoples and the governments of the countries where they currently live, right? So at least all over the Americas, any country, any place where you're standing, it's Indigenous land. I mean, people came from elsewhere over many centuries, but particularly starting in the 1500s, and started populating and building societies here. And then in most cases, those lands were taken without clear agreement or in situations and conditions that were pretty unfair, in context of illness, in context of like people coming from Europe particularly with weapons that were not, it wasn't hard to compete with. And then we see the reality today, and now, I was happy to see that flyer because in the context of the National Day of Reconciliation, that's now on the 30th here in Canada, for instance, there's so much tension usually between settler, colonial governments and indigenous peoples. And then add to that, then whatever was happening with the coronavirus. So one of the interesting things is that indigenous peoples, because they're pre-existing to governments and to nation states, they have been here forever. They are here still, even though governments have done like the most active efforts trying to eradicate indigenous peoples for centuries. Indigenous peoples are here. And they are, at least I do work with indigenous peoples, and I strongly believe in the sovereignty of indigenous nations, in the fact that they have rights that are unique, that are pre-existing, that are inherent. Because they were here before all of us, where I'm not assuming here, maybe there's someone here who identifies as First Nation or indigenous, but thinking about all the people who are non-indigenous to this continent, anyone else were immigrants and settlers, in different shades and colors, and coming 100 years ago or 2 weeks ago. And I believe in the need to recognize that we're standing on indigenous lands. And I think operating on that sense of autonomy and sovereignty, many indigenous nations in Canada, in Chile, my home country, in here, started quite early on reacting and taking their own measures to what they saw the pandemic was doing to their communities. And then here, well, the colors show different organizations and territorial councils, whatever. And then here, there's the kinds of actions that they started implementing. From their own perspective, their own reading of the situation, and in order to protect their people in the way they thought was appropriate. To give you certain examples, closing borders, closing boundaries, not letting people cross, prohibiting large groups of people getting together, large gatherings, suspending tourism. In some parts, that's a pretty sharp measure, particularly those governments that really kind of build money out of saying, oh, let's go see the Mayan pyramids, or, like when they said like, no, like people are not coming here, restricting access to the territory, campaigns, like communication and prevention campaigns, plans to provide water. This is something we're gonna see in the experience I'm gonna share. Many people don't have access to water. They don't have drinkable water. And then the government was saying, wash your hands 84 times a day for 40 seconds, like to keep yourself protected. Like, what do you do? Well, we're gonna give water to our people, giving information to different institutions, look for alternatives to social isolation. We were told isolate. What happens in so many communities and cultures where you don't leave your elders alone when there's a virus there? Like, we need to find alternatives. How do we make sure this doesn't spread when isolation is not the way to go? Kind of coordinating and supporting organizations and NGOs that are local, valuing local knowledge and traditional medicines, and kind of like trusting, because again, people have been doing their own medicine forever. Remote work in some cases where it was possible, transitioning to virtual meetings whenever maybe they had reception and things, developing internal protocols of what to do in case of COVID spread and infection, and providing, requesting the governments, the settler governments, to provide direct support for like peasant and indigenous agriculture, or kind of like activities, subsistence activities and productive activities. Moving into the little project that I wanted to talk to you about, and then you will have your own perceptions in terms of were they right, were they wrong, maybe they were misled. I'm happy to hear your opinions, but it's showing an experience of community organizing around what they were seeing as a threat at the time. Just to point out that what I'm going to show you, which happened in Chile, is not exclusive to Chile. That's why I was showing you this slide here in terms of indigenous-led reactions. In Canada, this is one of the other articles that I put on the reading list. In Canada, there were many indigenous communities who established checkpoints to prevent access through their territories. And this is basically what I'm going to be talking about now, now with you and sharing a little video. So the experience I'm going to be talking about doesn't happen here. It happens like 10 or 12,000 kilometers south from here in Chile. And the video I'm going to show you, it's part of a bit of a bigger project. So I've been working with Mapuche communities. Mapuche is the name of that particular indigenous nation, which is the largest indigenous nation in Chile. We've been working together for like 10 years, and more specifically in a bounded project that looks at indigenous ways of planning, or socio-spatial organization, for the past 4 years. So we were in the middle of a project that was supposed to last 2 years when the pandemic hit. So basically, I traveled to Chile twice a year, and then we were meeting there, we were talking to elders, and we were trying to, this was at the request of the communities there. They were like, we really want to try to tell the history of the territory from our own perspective, our own knowledge, particularly the perspective of elders who are passing away, particularly elders who are native speakers of the Mapuche language. And then we were doing that when the pandemic hit. That the pandemic hit meant right away that I could no longer travel for the foreseeable future. And then in Chile, the government acted in very, what's the word I'm looking for? Torpe. Clumsy, like in a very clumsy way, because again, like people didn't know, they reacted, oh, let's do vaccines, no, better, let's not do it, oh, let's shut down the schools, oh, no, actually it's for the kids. So there was all that chaos that many places experienced. But then one of the things that happened also is that people were not allowed to move too much. And in that context, very early on in the pandemic, the same communities that I was working with for the past years on documenting and writing the history of the territory, they started to self-organize because they felt that the central government in Chile was not knowledgeable about their local reality, that they didn't understand the needs of the community, that whatever measures were being taken at the national level, because Chile, unlike Canada is a federal country, and there's certain autonomy in terms of the different provinces. Chile is a unitary country. So basically the central government defines everything, and then it trickles down to the different regions and provinces. And they felt like these people from Santiago, the capital, they have no clue, they never set a foot here. What do they know about, again, like what we need, how our people are experiencing this? But most of all, they also felt the government was doing nothing, or at least nothing meaningful in their territory. So the project, what happened then, was that because they started self-organizing and actually setting up community checkpoints. And given that they started restricting access to their territory, A, B, even people in the area, they were not allowed to move. C, I was unable to travel, so our other project was totally paralyzed. And in that context, the idea came like, why not documenting what was happening with them at that time in the context of the pandemic? And we started first talking to people, trying to document in written. And then one of the people we were talking to, one of the indigenous women, said like, actually, you know what would be useful? That we have a video. That we can circulate and share via WhatsApp. WhatsApp is really used in Chile, where we can tell more people what's happening here, that we can show what we're doing, how we're organizing, and that this maybe can be learning for other communities, indigenous or not. It might also even, who knows, shape public policy in the future. Maybe the government would look at us differently. So the idea was to document this spontaneous rise of the community checkpoints that were led by indigenous communities, but also by other civil society organizations in a small rural coastal area of Mapuche territory, which is called Tirua. And then also, and this was more on the planning side, and like, well, it was a bit of a research exercise that we were doing too, is like, well, what's the potential of this kind of grassroots response to the COVID pandemic? And through a planning lens, because we were looking at planning with the other project, what are the implications? Like, is there something from a planning lens that we can learn from the way we are reacting as a community? So those were kind of like the ideas we had in mind. In terms of more specific things we were kind of trying to answer, it's, well, why and how these community checkpoints came to be, describing how things had happened over time, who started them, why, etc. Whether they had been effective or not in the eyes of the people who led them. And then did they have any longer term impacts, or was that initiative and that wasn't? And in order to do that, we did a number of things. We reviewed to get a sense of the picture from the government perspective, government reports, what they were saying in terms of how many people were being infected, how this particular municipality compared to others. We did initially phone interviews because, again, no one could move. But then finally, in late 2021, we were able to meet outside. When I go to Chile, it's always summertime too. And at that time, the restrictions had been lifted, so we did in-person interviews, like the ones you see here with people. So we were kind of looking at all these different kinds of sources of things. To give you a sense of where all of this is located, so this is South America, that's Chile. This is Santiago, the capital, and then where the red point is, that's roughly where Tirúa is located. This is kind of like the map that you would see in a conventional atlas. This is the map that I like to show that shows indigenous territories. And you can see Mapuche territory, the Mapuche nation, historically has lived in what are now the southern part of Chile and Argentina, from ocean to ocean. Now, because of the, imposed boundary of the Argentinian and Chilean governments, all the communities I work with are on the side of the Chile. Here, you might not know, but here's the Andes Mountains. That really creates a separation, physical, big, between what are now Chile and Argentina. So we were working on, it's called Wallmapu, which is traditional indigenous territory. And more specifically, we were working in this area here. That's kind of the municipality of Tirúa, which looks like this from the air. It's a relatively small, just a few thousand people live there. Coastal community, mostly fishing. It's kind of one of the main, fishing and agriculture, subsistence economy. It's what most people there do. Very high percentage of indigenous Mapuche people. Sorry, where am I? And then what I thought I would show you right away, because I already mentioned that they started kind of like self-organizing, and we finally produced a little video. It's 8 minutes long, that tells kind of in their own words what was happening at the time. So I thought I'll show you that, and then we can open up the conversation, because the relevant questions are, again, like whether it's COVID or not COVID, whether it's Chile or not Chile, whether it's indigenous communities or non-indigenous communities, what are the implications or what questions this kind of experience raises for community leadership, for what communities can do to respond to emergencies or to respond to anything that the community sees as a priority. Particularly when that response, it looks like it's incompatible with official responses. Absolutely. So what can be done? What are the assets, etc. Any questions before we go there? Show the video? Okay.
Nosotros nace la preocupación por el tema del virus, más que nada para entrar a proteger a nuestra gente. Y para nosotros como mapuche siempre es muy importante la protección con los mayores, porque en ello está impregnada todo lo que es la sabiduría y la cultura de nuestro pueblo, está en ello.
Y fue una buena idea, una iniciativa que se concretó en 4 puntos: el Tirúa Sur, Loncotripay, Los Cruceros, que está cerquita, y Tirúa Norte. Y así que ahí lo organizamos. Costó un poco en principio, pero nos fuimos dando cuenta que eran muy necesarios para cuidar la vida.
El gobierno que estaba de turno acá en la comuna nunca decretó el tema de cuarentena.
Y acá las decisiones fueron comunales, territoriales, y tomando en cuenta todos los actores. Acá no eran cosas que se decidía el CESFAM o el municipio, eran cosas que se decidían en conjunto.
El gobierno salió en los diarios, en la tele, diciendo, ¿sabe qué? No, lo que se está haciendo en Tirúa es algo ilegal. Pero él no sabía lo que estaba pasando nuestra gente acá si nuestra gente quería que la protección y donde ellos no lo podían dar.
Entonces igual estaba el miedo que de repente en cualquier momento podían reprimirnos y lo pudieron haber hecho. Lo bueno es que contamos también con el apoyo del alcalde y los concejales, que también no hay que dejarlo a un lado, que ellos también pusieron un poco el respaldo a esto para que resultara.
Pero después de 7 meses el gobierno sale alabando, diciendo, o la gente de gobierno diciendo, ¿sabe qué? No, fue muy bonita la experiencia que ustedes tuvieron, mira, lograron tener 7 a 8 meses Tirúa en cero.
Del comienzo, cuando lo organizamos, se empezó así entre dirigentes, oye, ¿qué hacemos? Hagamos barreras. Empezaríamos 5 o 6 comunidades, pero así se fueron sumando.
Fue una discusión igual entre nosotros mismos, porque igual teníamos miedo. Nosotros no sabíamos con qué virus lo íbamos a enfrentar. Iniciamos la barrera y hubieron reglamentos.
Y ya después teníamos, no sé, una vez a la semana, cada 2 semanas teníamos un día.
Participaban las comunidades, las organizaciones sociales, las entidades públicas que están dentro de la comuna.
Clubes deportivos, otras organizaciones de mujeres que habían aquí.
Se sumaron hasta después los camioneros.
Si bien al principio fueron las comunidades, después esas mismas comunidades fueron integrando más gente, que eso fue también lo bonito, que al final todos pudieron compartir y también nos pudimos conocer.
Pero la municipalidad fue un actor, uno más, y muy importante también, por supuesto.
Cada barrera se hacían reuniones y después se hacía una plenaria, se podría decir, donde nos juntábamos acá en Tirúa, y ahí se iban comentando la cantidad de casos, qué es lo que pasaba, y así se fueron tomando decisiones.
Cada presidente ordenaba su comunidad y cada organización igual.
Siempre se evaluó qué determinación tomamos, porque fue cambiando. Esto no era una cosa, era flexible en algunas cosas.
Como algunas decisiones fue el continuar con la barrera, el poner ciertas reglas antes de entrar, es decir, si alguien venía de afuera, por ejemplo, si venía algún familiar de Santiago, la gracia era que ellos hicieran una pequeña cuarentena en su domicilio.
Se hizo una restricción donde fuera de la comuna salían la gente que tenían hora al médico, medicamentos a comprar, cosas urgentes. Ellos tenían la autorización a salir.
También se tomaron medidas como colocar lavamanos en los lugares de los negocios.
La gente de las comunidades se organizaban, iba un turno porque eran de 5 de la mañana a 12 de la noche. Y ahí donde entraban a jugar nuestros mayores iban a dejar el tema de la colación, la sopaipilla, el café a lo mejor de repente.
Lo que nos dio la fuerza fueron la juventud, guiados por los dirigentes, por los mayores, pero lo que le pusieron el ñeque y todo ahí eran los jóvenes. Teníamos buen contacto con la gente. Siempre hubo roces, como en todos casos siempre hay sus roces, pero siempre se dialogó y se conversó y se arreglaron los problemas.
Nosotros el resultado bonito que nosotros dimos en esa barrera, que no hubieron fallecidos en ese tiempo que nosotros tuvimos.
Hasta que las barreras finalmente, por un tema de cansancio, también por un tema de que la gente tenía que... Era algo no pagado, era algo que lo hacían por voluntad, entonces ellos igual después tenían que cumplir su rol de ir a cosechar, de ir a plantar.
Y después de un tiempo, las presiones económicas que hubieron sobre las barreras pudieron más. La verdad es que nosotros igual nos sentimos un poco pasados a llevar, porque lo que nos mueve y lo que nos movió en su momento para poder hacer estas barreras era para poder proteger la vida de nuestra gente.
Después que soltamos esa barrera hubo muerte y ya uno compara el resultado cuando tuvimos la barrera y cuando no tuvimos la barrera.
Y el tema del virus llegó a nuestra comunidad donde lo golpeó muy fuerte, donde hubieron gente que es muy importante en los territorios que tuvieron que partir al otro mundo, al bueno mapo, como decimos nosotros.
Y si sacábamos la cuenta, los primeros meses nosotros no tuvimos ningún contagio, donde el país estaba prácticamente tapado en contagio, nosotros no teníamos contagio. Entonces en sí las barreras resultaron.
Entonces eso fue importante, el aprendizaje, y que se pueden hacer cosas.
Demuestra entonces que, como experiencia, cuando la gente se une para un bien común, para la vida en este caso, resulta.
Y el hecho de proteger nuestro territorio, de defenderlos de las forestales, de toda esta empresa, también nos dimos cuenta que es una cosa muy más grande. Toda esta recuperación no es solamente para protegernos a nosotros como mapuches, no es para tener más tierra, no es para hacernos ricos, sino que es para proteger todo lo que hay dentro de nuestro territorio.
Uno ahí se da cuenta de que si las cosas se hacen bien, el territorio podría controlar su territorio.
Cuando nosotros lo vimos amenazado, como se dice, nosotros lo unimos como sea.
I know we're 3 minutes away, so the thing that I wanted to do was only to, and I'm happy to share the PowerPoint with you, was to leave some questions, which I think most of them actually we kind of already covered in the conversation. But it's again, whether it's Chile or not, whether it's COVID or not, whether it's indigenous communities or not, it's, so did you participated? Well, that's my Spanish showing here. I thought, but you already mentioned so many things, just to get us thinking, if you had participated in any community-led efforts in the context of the pandemic, or for that matter, anything else, what were the main takeaways, what things worked and didn't work, and in a way, the why. And I think you, for instance, were mentioning here, like, well, I think the places where some of us come from or whatever we have, kind of, it's part of the way we operate, and you were mentioning the same. Yes. And then identifying what are some of those things that in a way bring people together and that might allow things to, and then the question, which was a bit more skeptical on my end, is like, can initiatives of this kind survive over time, or how can they survive over time? Again, what are the kinds of things that make something like this work and be effective and bring people together and produce the change that communities desire? What are some of the challenges, and is there anything that can be done? In this case, I don't know, maybe if there had been more political support in certain ways from the central government, for the government authorities, maybe some financial assistance, maybe not criminalizing what they were doing, maybe all those things would have allowed more control to be held by the community and not dismantling the things overnight, you know? And then also, which I think is always a really good question, I'm all for community planning, community initiatives, community-led action. But then there's also what's the responsibility of communities in making sure that we are doing well? And what's also the responsibility of government / officials / policymakers, you name them, but the people who supposedly are in quote unquote power, who are making decisions on our behalf, from whom we expect certain things, and that they should be delivering because they're elected for that, they're paid high amounts of money for that, and many times they are not operating in the best interest of the communities they serve. So this permanent kind of tension, it's like communities do have a role and a responsibility, but then also it's like, well, and what's left then for these other people who also should be being at the service and supporting people? So I'm gonna just leave you with those questions, and it's been such a pleasure to have the conversation. So thank you.
Thank you so much for watching. Don't forget to like, comment, share, and subscribe to our YouTube channel. Also follow us on social media, and for more information, check out our website.